Here at the 2011 ONS conference, we're delighted to have with us Ms. Ginny Martin. She is the Clinical Director for Ambulatory Care Nursing at the Fox Chase Cancer Center in Philadelphia, PA. Thanks for being with us.
Sure.
Okay, so you work with patients with ovarian cancer every day. How are things now for them?
Treatment is tough, but the women are fighting hard, and diagnosis is often late, so disease can be advanced, and the major focus right now, I think, is to try and get the word out about ovarian cancer and the symptoms that exist for the disease so that people can be aware to know what to look for and to try and catch it early.
Based on what you said, Ginny, and the need for early detection, advocacy really is a key. Can you talk about your work in this area?
Sure. For the about last 5 or 6 years, I've been involved with the National Ovarian Cancer Coalition. I've been on their local chapter advisory board, but not currently. That term is up. But their mission is to promote education and advocacy for women with ovarian cancer. And the focus is on both of those areas, education and advocacy. Often they have local chapters in the United States where volunteers work with people to try and get donations, obviously to try and fight and raise the awareness. They get information out to people, resources available to women, and they're a wonderful organization to provide support to the individual with the disease. Of course, they're always lobbying for more money from the federal government for research, but their focus is not to promote research, it's to promote education and advocacy.
So how does the NOCC reach ovarian cancer patients, and what does the organization do for them?
One of the probably the nicest touches is for women who have had surgery, which is usually where ovarian cancer diagnosis starts. They try and get resources out to them. They have available packs, that they've put together with a lot of different, written material and also some resources for them as they're, beginning their journey to treatment.
You work with ovarian cancer patients on a daily basis. What do they need most?
I think at first, tremendous support. Often people with new diagnosis are totally overwhelmed. Some people come armed with lots of information from the internet, and the statistics are grim. So support, first and foremost. Many women with the disease respond well to treatment, and many, even not many, but some women are even cured. Our goal is obviously to get more women cured, and in order to do that, we have to get the information out about the symptoms that exist. They can be very frustrated with this disease, having had the symptoms that can be confused with general symptoms and maybe not necessarily ignored, but dismissed in some cases, or probably more often pursued, and that the obvious diagnosis has just not been made at that point early enough. But, I think they need education and support first and foremost. They need to get to a competent center with a gynecologic oncologist, because often surgery is the first step. And that's where I think everybody tries to provide that education and support to get that individual on the right path.
The NOCC mission really seems to be twofold. One, to help patients, and two, to get out the word about the need for early detection.
Correct. Often the chapters in the United States have very active organizations that have walks. September is the month that's been set aside to raise awareness in gynecologic cancers, specifically ovarian cancer. So there are often walks, and that's obviously a time for the survivors to come together and get recognition and support, as well as, raise money for awareness.
What else could we do to help you get out the word about the NOCC?
I think this is a great, venue to do that. People can go to www.ovarian.org. That is their website, and that will provide them with a lot of information and also, get them on the right path to the resources that they may need to fight this treatment and disease.
The women at the NOCC are very dear to you, aren't they?
They're remarkable women that I care for, that have provided me with the strength and the inspiration to continue my career in oncology nursing. I get tremendous strength from their strength, and they're an incredible group of women.
Ginny, special women seem to kind of hang out together. Thank you for your time. Thank you for your work that you do both at Fox Chase and for the National Ovarian Cancer Coalition. Ginny Martin joining us here at the 2011 ONS conference on Oncology.TV.